We're excited to offer a new service for feminine rejuvenation called Votiva. It is a non-invasive and non-surgical procedure that will help with feminine rejuvenation. The Votiva works by emitting radiofrequency through a wand. What that does is it heats up the tissue and creates tightening and toning of that tissue and muscle, as well as helping stimulate lubrication and sensitivity. For younger patients, this is a good treatment to help relieve any stress incontinence that they may be having, to tone and tighten the tissue, and also to increase sensitivity and lubrication. For our menopausal patients, it's a good way to relieve the dryness that comes from menopause, as well as help with vaginal atrophy that may occur as we age. A wand that is very similar to a transvaginal ultrasound wand is inserted. You'll feel a warm sensation during the treatment. We can do treatment internally as well as externally, and like I said, it's completely painless. When you leave after the procedure, you can go back to normal activities. Patients can expect to see some slight results immediately after the procedure, although the more time that goes on, the more time there is to tighten that tissue. So the optimal results you'll see 8 to 12 weeks after the treatment. For the best results, it's good to do at least 3 treatments, and then it's recommended to do an annual maintenance treatment after that. For patients that may have excessive or loose tissue externally that they are self-conscious about or wanting to change, we can do a treatment called Morpheus on that tissue, and that is just an extra step to help tighten and contract that tissue. With the combination of the Votiva and the Morpheus treatment, you can see results after one treatment, especially for the external tissue. I've been very pleased and surprised by the visual difference that you can see after just one treatment. If you were to come in and just get the FormaV or the Votiva treatment, what you can expect afterwards is essentially returning back to your normal activities. Depending on the treatment settings, you may need to withhold from intimate activity for at least a day. You may need to withhold from extremely hot water in that area for at least a day. After you have the FormaV or Votiva treatment, there is no pain or tenderness in that area after the treatment. If you have the FormaV and the Morpheus treatment together, you can expect a little bit more downtime. There'll be a little bit more swelling due to the numbing injection that is done on that tissue. So you'll be down a little bit longer. It will be a bit more sensitive in that area for at least a week afterwards. If you have the Morpheus treatment along with the FormaV, it would be best to withhold from intimate activities for at least 3 to 4 days. Aftercare for either of these treatments is pretty minimal, although sometimes after the Morpheus treatment it may be a little more tender in that area, and you can absolutely apply healing ointment like Aquaphor to the tissue. For the Votiva treatments, it's recommended to do at least 3. You can do those weekly, or you can space them out up to 2 to 4 weeks between, depending on your schedule. To do the Morpheus treatment along with the Votiva, it's better to wait at least 4 weeks between the Morpheus treatments. It's just a little bit more of a procedure on the tissue, and it's best to let it heal between those times. So Morpheus treatments every 4 weeks.